want to know what to expect if you are in CRNA school, or if you want to become a CRNA, or if you're a nurse and you're like, what is level 1 trauma experience as a CRNA? What should I expect? What will you see? Well, in this video, I'm going to talk all about it because I had at least many years of trauma experience, and I'm here to disclose all of my information and what I've learned and what to expect. So definitely keep watching. My name is Christine and welcome to a new video. If it's your first time here and you want to become a CRNA or grow your CRNA career, start now by subscribing and hitting the bell so you don't miss anything. So I am currently an experienced CRNA and I love what I do, and I am all about giving you the knowledge and wisdom to make an educated decision as well as allow you to grow in your profession. Maybe you want to grow as in nursing, because I have some information about nursing, especially I am a registered nurse. I have many years of ICU experience. As well as maybe you want to become a CRNA and what to expect in school. As well as if you are a CRNA and maybe you're thinking or considering going into a level 1 trauma center, what is that? What should I expect? Can I do it? Well, I'm going to tell you all that information now. So don't miss anything, because every step that I'm going to discuss will give you the knowledge and let you know what's real, what to expect. So let's get into it now. So I can give you, from my background, the information about level 1 trauma experience. But first, we're going to get into that soon, but let me first give you some information about what level 1 trauma means. So a level 1 trauma center is a comprehensive regional center that is capable of providing total care when you're injured. It provides the highest quality of care when it comes to traumas. I mean, if you're in an area that you may have had an accident or you've gotten really hurt and injured seriously bad, for example, a gunshot wound to the chest, they're going to transfer you to a level 1 trauma center because they have the capabilities to treat you appropriately, and they have a lot of standards that are available to you to treat you and get you stabilized efficiently. So just remind yourself that when you think about level 1 trauma centers, they have the resources to provide excellent care for you when it comes to being injured, and they have the resource to treat you optimally if you are seriously injured. So when you think about being a CRNA, what does CRNAs do when you're thinking about trauma? Well, I'm going to give you that information now. Well, as a CRNA, I worked in a level 1 trauma center for many years, and I got a lot of experience. I got to see a wide range of cases mix at the hospital, as well as I had very sick patients. I mean, it reminded me of my ICU rotation. Taking those ICU patients, now putting them into surgical setting. So that's my mindset when I think about what experience I've had. So I'll give you an example. I remember when I was an ICU nurse night shift, and I did the night shift, and you have a patient come in, gunshot wound to the chest, maybe they had a really bad fall injury and they had to come in for a emergency craniotomy, or they needed a serious vascular case, or they had a really bad car accident. They would come to our hospitals and we would have the capability to treat these patients. These patients would be under rapid blood transfusion protocols. These patients would be getting multiple blood transfusions rapidly to make sure they can be stabilized. They're on pressors. We are giving minimal anesthesia gases. We're putting in invasive lines, central lines, arterial lines to monitor beat-to-beat monitoring. You'll be documenting them, especially as titrating drips, as well as titrating the amount of fluids you're giving your patients as well. You're working closely with the anesthesiologist, as well as if you are in an institution that is just CRNA only, you'll be working by yourself. You may have, for example, a trauma nurse that will be there to help guide you. They'll be focusing on giving the blood transfusions and also taking lab work while you go ahead and manage a patient and stabilize them. So that's just a minor information in regards to a CRNA in a level of trauma center, but those are the things that you can expect. Especially, that's night shift, right? Day shift, what do you expect? You could be in a case, and maybe your case is finishing and closing, maybe in a GYN case, and you're thinking, oh, it's gonna be a smooth day, I have a GYN case. Then you complete your case, everything's going smoothly, you transfer your patient to recovery, everything's good, and your patient's doing great. Then couple minutes later, you can get a phone call on your phone saying, hey, we have a 16-year-old, multiple injuries, car accident, going to be in your room within the next 5 to 10 minutes. whoa, what? So you got to think about what you're going to do, how you're going to prepare yourself. And I did it, And also you have my coworkers. I mean, sometimes you may be by yourself, like a night shift, and it's like, whoa, I have to do this by myself. But then on day shift, usually you have a very good team. I mean, when I worked at my team, the CRNAs I worked with, as well as just in general anesthesia providers, were amazing. And so we would go into the room, set up our room, make sure we have all the emergency drugs, make sure we have all of our airways set up ready to go, and all of our invasive lines prepped and ready to go. Bring this patient into the room, get them on the monitors, intubate them, stabilize them, give them what they need, gases versus, medications, as well as blood products, taking lab works, making sure, things are, we're doing everything appropriately. And it can happen on day shift. So some hospitals, they have a designated person that's going to be the trauma person, that's going to be their job for the day. They're going to be like basically waiting. While some institutions, they may not have enough anesthesia providers. And if a room comes down and they don't have enough anesthesia providers, whoever comes down first and there's a trauma coming back, well, that room is going to be on hold for that case. And they're going to hold up all the other cases. Maybe they'll move those cases to another room. And you'll be the designated person providing that anesthesia. I remember my first year in a level 1 trauma center, I was, of course, getting my skill set on point. Yes, I had clinical experience as a CRNA, and I felt very comfortable. But there's something about being on your own and actually have to think critically. Because as a CRNA, you're not just, you work collaboratively with the multidisciplinary team, but you work with your anesthesiologist, or depending on the institution you're working at, maybe you're working by yourself as a CRNA. But in general, even if you're working with an anesthesiologist, there's an expectation that you'll be able to medically manage this patient with their assistance or by yourself. With time, they develop this relationship with you, and they can see your skill set, and they can see if you can handle these situations. And in the beginning, it was a rocky road, and because I'd had a lot of trauma experience. I mean, we had babies, or we can have, for example, the elderly population, a variety of comorbidities and medical history, as well as a variety of medical conditions, injuries. I mean, there's so much you can experience in a level 1 trauma center, which is a great thing, but you definitely have to be able to work in a fast-paced environment. You have to be able to think critically and manage these patients and be confident enough that you can manage these patients, because a lot of times you'll be manage these patients by yourself. I mean, you do work with an anesthesiologist depending on your institution, but you're doing all the legwork. You're making you're troubleshooting, you're making all these critical care decisions. You are managing these patients on your own. I mean, you're an advanced practice nurse, in anesthesia. So you're a specialist. You're a specialist with airway management. You're a specialist with hemodynamic monitoring. You're a specialist with many things. And at the same time, yes, you're doing this, but at the same time, you have to make sure if you're having any issues, you need help, ask for help. And I never had a shame to ask for help, even from the people that I worked with in the OR. Constantly communicating with the surgeon, constantly communicating with the nurses, constantly communicating with the surgeons, and making sure things were done efficiently. And we all worked like a team. So that's great. I mean, and the great thing about working in a level 1 trauma center, you're going to learn so much. A lot of these institutions are teaching hospitals, and you're going to learn a lot and grow a lot. And yes, it's going to be fast-paced. You may be stressed. You're going to see everything. But when you are a CRNA in that environment, when you do leave that institution, or you leave and go to another area, maybe you decide that you want to go to a community hospital, a level 3 community hospital where you're not going to get traumas. At least you got that under your belt, so your skill set is on point. You can manage patients, and when you do once in a while have a very sick patient, you know what to do. You're prepared, versus never having that experience. For example, if you worked in an endo area, and maybe that was your first job, when something happens critically, you may not be as fast-paced, you may not be able to think fast enough, because you have the knowledge, of course, as a CRNA, but you don't have that experience with level 1 trauma center. You can see things differently. You can observe things differently. You look at your surroundings and you pretty much know what to do, but at the same time, sometimes you question yourself, because you were like, did I give this patient the appropriate amount of care? Did I do things the way it should be? And of course, when your patient does well and they go up to the floor and they're stabilized, and then you hear maybe a week or two later that they're extubated and they're doing well and they're going home, that makes you feel great to know that you are that person that stabilized them at the most difficult points in their life. And now they're able to go home, be with their family, be with their kids, you know? So those are some things the one thing that I loved about working at a level 1 trauma center. But now for me, for example, I've had that experience and I've loved it. But now I'm working in a community center and I am happy, you know, and I love that because I had that fast-paced environment, but now I have kids, I have a family, and I just needed a change, you know, because at the end of the day, for me, I needed a work-life balance, and now I have that. So definitely think about that when you're thinking about level 1 trauma experience. Now, say, for example, you have no kids and you want that, you know, adrenaline rush, you can have that. But if you say to yourself, you know what, I want to get that experience, but maybe 1 or 2 years, I'm going to get that experience and then move forward, you can do so. I mean, at the same time, you could try things. And, you know, you may see something and try it once and may say you love it, or you may say you may not love it, and that's okay. But here, I'm here to give you that detailed information about what to expect, what I've seen. And this is just the tip of the iceberg. I mean, there's so much more I can tell you. But I just want to graze and give you a foundation so you kind of know what to expect and what is it, right? So that's what I'm here for. I'm here to give you that knowledge. And now, what I want you to do is comment below with specific questions, and I'm here to answer those for you. And if I don't know it, I'm gonna try my best, but at the end of the day, I wanna hear it all right? So if you wanna learn more about CRNAs and how to grow your CRNA, definitely click one of these videos over here, and I'll see you in the next video.